And among the most popular study abroad destinations for SUNY Oswego students are France, Italy, the United Kingdom, or Spain, where I am currently at. Curiously, all of these destinations are labeled as level 4 based on their COVID health risk by the CDC. It is expected that medical facilities like this one right here will receive the Pfizer vaccines on the 26th and begin administering them on the 27th. Now, tensions and clashes are even palpable here on European soil between those supporting Biden and those supporting Trump. En un año normal, en puntos de salida como este se producirían controles para medir el nivel de alcohol en sangre, pero sin embargo, este año, en la noche de Navidad y Nochevieja, lo que se va a medir es la puntualidad en el toque de queda.
Lights, camera, action. As we surpass the one-year mark since the national lockdown was enforced in Spain, theaters in Madrid are embracing the cultural transmission. While not all regional theaters reopen at the same time, just having the opportunity to again share stories was a gift. It feels great to just be able to celebrate this moment, even with international companies, as the Schengen area remained open. A sense of communion that has prevailed social distancing and has still managed to bring people together. In the end, what people want is to live the theatrical experience in communion, because without a community, there's no theatrical experience. But in order to keep the momentum going, the theater industry in Spain will need yet another boost coming from Europe. During these times, European support is more important than ever. This support is not only geared toward the creation, but toward the survival of the industry. As we hit the one-year mark since COVID-19 was declared a global pandemic, nations across the globe are still struggling to get enough vaccines to the arms of their senior citizens. For countries like Spain, the biggest challenge has been grappling with caring for a growing senior population in an inverted social ladder. Recent social work graduate Mónica Garcia says the biggest challenge faced at the beginning of the pandemic was the lack of employment in a collapsed system. When we returned in the summer after 3 or 4 months out of work, a lot of patients I had been working with for a year had passed away, some were seriously impacted, and others had relocated with their families. Social workers in Spain are predicting a 30% increase in dependent individuals, a number that does not necessarily account for elders and persons with disabilities. We will have dependent individuals for economic reasons, lack of resources, or as an effect of COVID. But aside from the pandemic itself, Garcia points at yet another invisible enemy caused by COVID-19. This remains largely unknown because the media often doesn't talk about it, but many have died after days unable to eat because they didn't have someone to help them. After the European Medicines Agency earlier last week deemed the AstraZeneca vaccine unsafe, the distribution and administration was abruptly brought to a stall across the board on European soil. However, just a few days later, Europe's medicines regulator reversed and concluded the vaccine was safe and effective. Among those receiving the AstraZeneca jab in Spain are teachers, military personnel, and law enforcement officers. We were summoned immediately to get the vaccine. We're at-risk personnel. We're receiving AstraZeneca, and there's a massive vaccination campaign for those under the age of 55. For educators specifically, the sudden transition to remote learning when the national lockdown was enforced last March meant quickly adjusting amid uncertainty.
They said we were entering a 15-day lockdown and told us to assign homework for 15 days, but we wound up being in this situation since mid-March until mid-June. But returning to the classroom in September was yet another challenge for many. There was a lot of fear in September. We returned amid a surge in cases. Everything was uncertain.